Navajwara, Kashaya Kalpana, we should not use. Then why we are giving Shadanga Panya?
It is not Kashaya Kalpana, and Charaka has very explained it. Ekasha न तु कल्पनमुद्दिश्य कषाय प्रतिषिध्यते यः कषाय कषायस्यात् स वर्ग्यस्तरुणज्वरे. You can understand, I think.
Yes.
न तु कल्पनमुद्दिश्य कषाय प्रतिषिध्यते. कषाय कल्पना is not contraindicated in the jwara. यः कषाय कषायस्यात् कषाय रस samyukta kashaya kvata is contraindicated because kashaya kalpana, not kashaya kalpana, kashaya rasa creates malastambha, and the evacuation of bowels will not be proper, so that kashaya rasa kalpana is contraindicated in Navajwara.
Sir, next question. How to treat Hasta Pada Daha? Most of the patient after giving Tikta Pajana and Pitta Shamaga Kalpana, it will not reduce. Both obese and thin patients, the doctor has seen it seems.
Yeah. Okay. When you get Daha, you have, first we will think that it is due to Pitta. Because Daha is the symptom of Pitta. So we have to find out whether it is associated with Kapha or Vata. So maybe sometimes Vata may be there in the degeneration conditions where Vata is increased. It will take the Pitta to the some the sthanas that is called as Ashaya Apagarisha. Thadukshaya Janya Daha will be there. In Rajeshwa it's a Daha, it is due to the Vata only. Vata and Pitta may be sometimes increased, or Pitta may not be increased. Due to Vata increase, it takes the Pitta to some of the organs. In such conditions, we have to find out that it is due to Vata, and when Vata is treated, the Daha will come down. If there is a blockage due to Kapha or something, we have to relieve that condition so that Pitta will be decreased. Pitta will come to the Koshta and can be by Virechana or etc. we can relieve. So this association also we have to think. Not only the thing symptoms, which dosha has been associated with that, accordingly, in Vata Paitika, Ghrutapana is advocated. That is why Kashaya Pana Patyanyir Dashaha Iti Langide Sakpir Dadya Kaphe Mande Vata Pitto Jware Vata Pitto Tara Jwara. So these conditions we have to find out and accordingly treat them.
Okay, sir. Thank you. Sir, next question. How Anuvasana is Vayu and Astapana is Akasha and Nasya is Prithvi? Can you please comment on it, sir?
What is the confusion in it? I don't understand.
Actually, Dr. Swati has asked it. If Swati is here, you can please unmute and talk to sir.
There is no confusion in it. It's according to Panchabhutas we have told.
Yes, right, sir. Okay. Swati, you can speak to sir. Hello, Swati. Okay, sir. Anyway, we'll go into the next question. Sir, it is a question from Dr. Ujjwala Shelar. She is asking that she has a patient of Anitra, same as a case you told her. Both kids are studying in US. Because of Anidra, she gets headache, Brahma, and doctor had told her to do Shiropiju, Abhyanga, Saraswada Arishta. Her headache and Brahma has reduced, but still she has Anidra problem. What will be the line of treatment? her kids can't come here as you said in your case.
Yeah. See, we have to find out the subtle causes behind it. So, if and for that we have to do a counseling of the patient, and there should be an intimacy between the patient and the doctor, so that she will tell what the causative factor which hurts her. So we can find out solution for that accordingly. If she has some um, problems with son, daughter, or family, etc., we can talk with them also, and they may not be knowing this is the cause. So it can be by family counseling. It can be arranged. See, pitta, chikitsa itself. Acharya tells about it. Even the hearing of sounds of the children, the mind will be pacified and pitta will be decreased and maintain equilibrium. So that is very important. Even if the wife is very much uh, good relation we have got with the wife, it will be a chikitsa for pitta. So these are the, so we have to find out these are the causes for pitta vitiation, and we accordingly we have to do it.
Treat it. Okay, sir. Thank you. Sir, next question. Dr. Manoj Kumar is asking, can you please describe the treatment protocol of the spinal artery stenosis that you had shared?
Yeah. I told you, the patient was having incontinence of um, urine and also feces, and she cannot even move the fingers like in the tarsals, etc. And so, at that conditions, we we were admitting her in the modern hospital itself, and we were advocating medicines. See, first we gave Intugantam Kashayam with Gorojanadi Kudika, and also Ashwagandharishta and Dasamularishta also. Um, and the main treatment is this only, Indugantam Kashayam. And after some time, we switched on just by seeing the conditions. We mixed Indugantam Kashayam with the Mustadi Marma Kashaya. This is one Kashaya which is used in the conditions of Vadiga disorders we were using, and also Gulgulittan Kashayam also we were using, and Matravasti was continued for 2 months, and I think by the medicines and also the Vasti, Matravasti, the Vadanulomana has occurred, and after that she was able to move her legs, and also now she is walking also, no problem. She is doing her duties.
Okay, sir. Thank you so much. Sir, I would just request one of our participants who have raised the hand to talk to you.
Yeah.
Abhinanda. Abhinandan. Dr. Abhinandan, you can speak. Hello, Dr. Abhinandan. Yes, you can speak. Hello, Abhinandan. Dr. Abhinandan. I'm sorry, sir. He's not. Sir, we'll go to the next question. Sir, in Pitta Kafaja Jwara, how Shita and Ruksha Dravya be selected? As Shita Guna can deviate Kapha also.
See, that question was, yeah. There is a condition of some that is samsargaja vyadhi. where kapha and pitta may be increased. In such conditions, we have to treat both the doshas. So there are some medicines which are prescribed for samsargaja vyadhis. In the text itself, it is explained. So the question or the doubt may be, if you Pitta increases, Kapha will decrease like that. It is not like that. Both may increase in such a condition. That is why Samsarga Vyadhi occurs. And it is explained in the, we should know the text that is um, Rasavaisheshika. He explains about it. One dosha increase, though they are opposite, may not essentially decrease the other doshas. Both can stand. Like gunas, some sattva guna, rajoguna, and tamoguna, though they are having different gunas, the sattva guna and rajoguna can increase, or rajoguna and tamoguna can increase. So
Right.
that is there in the body, and essentially it cannot be told that one dosha will decrease the other doshas. That doesn't happen in the body.
Okay, sir. Thank you. Sir, next question.
And one thing also, the kapha increase occurs by ushna guna. Prakopa of kapha is occurring due to Ushna Gula. In Vasanta Kala, Ushnena, Ushnena Kobam, Ushnena Kobam, Kaphatinda, the Koba of Kapha occurs by Ushna Guna.
Right, right,
Okay.
sir. Okay, thank you, sir. Next question. Sir, Dr. Vishakha is asking for lactose intolerance. What is the alternate treatment? Example, Tikta Kshira Basti or anything.
Lactose intolerance, we have to avoid milk. That's all the things. But if you treat with some, I have not got that experience of lactose intolerance treatment. Still, if we try for some of the changes in the body, which which creates the lactose intolerance, when we treat it, the causative factor, it can get some results sometimes. I have no clinical experience about treating lactose intolerance test, but we can try for that. I did not get such a case to be treated. We tell that you don't take milk. If that is the better remedy we can adapt.
Right, sir. Right. Sir, another question. The selection criteria for Amrudottara and Dashamula Kadutraya Kashayam, how to select in which roga or avastha?
Yeah. Amrudottara, it has got three medicines only. One is um, Amrita, and also that is uh, Chukka, that is
Shunti.
Shunti, and also Hari Pranada, that is what do you say, Triphalas Tadka,
Vibhidagi.
Bibhi. These are the three things. So in Amritottara, that gives Malashodhana very well. But the Dashamula Garutraya will not give Malashodhana. So when there is a need of purification and a relieving of ama, through a purificatory process, we can use Amritottara Kashaya. So ama will be relieved and also evacuated from the body. But Dashamula Garutraya is different, where it may be sometimes Sangrahi. So in such conditions, where kapha is too much and adhisara is occurring sometimes, in such conditions, the Dashamula Garutraya is best. When there is no evacuation of bowels, Amritottara is best.
Very apt answer, sir. Thank you, sir. Sir, next question. Sir, from Pooja. Respected sir, what is the treatment protocol for excessive Hasta Sweda?
Yeah, Hasta Sweda. Yes,
Ah,
yes. That's a common thing we are getting. Many of the, I think it occurs in the age of adolescent and also up to 20 years. 10 to 20 years, some of the people, students, etc., they are getting these problems. In such conditions, the very effective medicine uh, we used to prescribe is Tiktagagridam. It is due to the Pitta Dushana only, Pitta Vardhana only, and Girdapana, Tiktagrida is very effective in this condition. Some of the cases where they don't like this Pitta Grida means we can utilize Kashaya also. But Pitta Samshamana is the principle behind it. You can advocate Tikta Grida or Mahatikta Grida for that.
yes, sir. Sir, next question. If continue sneezing twice or thrice every day with watery running nose, is it because of kapha or pitta? And line of treatment also, can you please explain?
Yeah, that's a real question, I shall tell you. The running of the nose can occur in two conditions. One is due to kapha and one is due to pitta. I shall tell you that. Then allergic conditions, allergic eosinophilia, in such conditions, modern we are diagnosing that it is due to allergy means in such conditions, kapha is increased. And we will get good result in such conditions by Kabhagna Chikitsa, Kabhara Chikitsa. For that, we can advocate many kashayams are prescribed in the, like that Dashamulagadutraya and also Pathyakshadatryadi Kashaya. All Pathyakshadatryadi is very good in such conditions. And Bilwadi Leha can be given, Oshadi Vadaga can be given, and we have to tell the patient rather than these things, what you have to identify what are the allergic factor in that patient. So there are allergy tests are there, and I used to tell some of the things which chira, it increases kapha, and chocolate. Many of the children they may be taking chocolate, and water will be taken from the fridge, etc. Cold water in such conditions, and also smells are the allergic conditions like. Sandal, bati, etc. In such conditions, you have to find out the cause and avoid it. And in Paitya condition, there is one condition where it can be in Chikilsa Manjari, he says, when pitta is increased in the head, in such conditions, there is a condition where the uh, sneezing or srava can be occurring due to the increase of Ushna Guna in the body, in the head. In such conditions, some of the tailas applied in the eladi coconut oil, etc., and nimbamradadi coconut oil, etc., when applied in the head, it will be decreased. When after jwara, after taking medicines, etc., without taking snana, etc., still the running nose will not subside. In such conditions, if we apply um, appropriate thaila in the head, it will be stopped. So these are two conditions.
Okay, sir. Thank you. Sir, next question from Dr. Ujjwala. Sir, if obese patient come with chronic constipation, as we give first pajana, then shodhana. So this condition is okay. When given shodhana with pachana, can we give shodhana with pachana?
Yes, yes, certainly, certainly. See, Abhipattikara Churna, it is Pittagna and also it is Deepana, Pachana and Shodhana. There are some of the medicines like Amrutotharam. It is Deepana, Pachana and also Shodhana.
Okay.
So that is the main benefit of the Kashaya yogas. Kashaya yogas, they it has got some intellect. The Kashaya itself has got an intellect. It specifies all the things. That yoga is made according to that. Different systems are managed. Not only one system, not only the digestive system, not only the respiratory system, cardiovascular system. Everything is, it has got an arrangement that it controls all these sections. So we can have it. Okay.
Sir, we have Ujjwala here. Ujjwala, you can speak.
Sir, good evening, sir.
Please, can you increase the volume of your...
Hello. Hello.
Hello, Ujjwala, can you please increase the volume of your
Hello.
microphone?
Hello.
Sir, are you able to listen to her, sir?
No, I don't hear anything. Let her, you please tell, she can chat and tell. You can read it and tell.
Okay. Actually, sir, she is doing counseling for the same patient every week. And before she had asked a question about Pada Daha. For this patient only, she is asking Pada
Yeah,
Daha, which is not reducing.
yeah, yeah. No, I shall tell you.
Okay.
Uh, we can go for counseling. That is good to relieve the causative factors. Otherwise, symptomatic vyadhi, vyadhi viparita chikitsa also can be adapted. In such conditions, Shatadausa can be applied for the parts where this daha occurs, and also Tikta Kashaya, Tikta Grida, etc. can be given if it is suitable, and Pittagna Chikitsa should be done. Vada Pittagna Chikitsa will be benefited in the cases of Alpanidrada, and Chirabala can be applied in the head and body also. Shatadhavda Grida can be applied in the body parts where Daha is there. It is very much effective. Chirabala 101, etc., can be applied in the head with Kachoradi Churna or Rasnadi Churna, which gives very good result. Even there is Manasa Mitra Vadaga, if it is if she has got any mental problems or just Anidrada, if it is there, it can be advocated.
Okay. Okay, sir. Sir, another question. Um, Treatment and principle of Brahma, migraine, tinnitus, arochaka, leukoderma, etc. Sir, can you please tell us the treatment principle of Brahma? Brahma.
Brahma occurs due to Pitta and Vada. Pitta is the main thing in Brahma. Like in the anemic and Pandu, etc., Brahma is the main thing which can be seen. So, Pittagna Chikitsa will be very much effective in the conditions of Brahma. So, see, even in Pandu, we can see Kalyana Girda and also Tiktaka Girda are explained. Pitta Kushta Parisarpa, these things, Brahma, etc., can be relieved by Tiktaka Girda, and Mahatikta Gridar can be advocated. Even some of the cases where Kalyana Girda also can be utilized. It has got special activity in the Urdhva Bhaga, so it can be given. Even Pandu Kalyana Girda is used where Brahma is there, so it can be advocated. But we have to see what is the causative factor behind the Brahma. Brahma can be a symptomatic, the symptom can originate in many conditions, even in the conditions of um, labyrinthitis vertigo. We should address that condition. Even cervical region erosion, etc., cervical bone erosion, or disc prolapse, etc., cervical disc prolapse, that also may sometimes result in Brahma. So we have to find out, or we just by the in increase of pitta or amla pitta, Brahma is occurring. So we have to advocate such things in accordingly medicines for that amla pitta. So we have to find out the causative factor and treat accordingly.
Okay, sir. Sir, can you please share your experience of treating Down syndrome?
Yeah. I told you that case itself, she was having Down syndrome. But Down syndrome should be treated not only by medicines. We have to give her training also, educate her, and also there are some protocol for Down syndrome, how that can be advocated. Otherwise,